All right. I'm going to go ahead and get started. So thank you everyone for joining. My name is Amol Sinha. I use he, him pronouns. I'm the executive director at the ACLU of New Jersey. And thanks for joining our Save Medicaid town hall conversation with Congresswoman Bonnie Watson Coleman and a group of experts who have joined us as well. Before we get started, I just wanted to share some logistics notes. We have a captioner here, and so if you click the Show Captions button at the bottom of your screen, you'll be able to see the closed captioning. And secondly, if you have a question, please use the Q&A feature at the bottom of your screen, and we can try to incorporate those questions in the conversation or save some time at the end. So let me start first by talking about why we're here. So first of all, we firmly believe at the ACLU and across our movement that access to healthcare is a human right, and that the vast majority of Americans we know are with us. They support Medicaid. They oppose cuts to Medicaid, and in fact, they want to see deeper investments and not cuts. Nationally, Medicaid has been a lifeline for millions of people since its inception over 60 years ago. Medicaid provides health care for working adults, for people with disabilities, and seniors and kids. And nationally, Medicaid is the largest healthcare provider for people with disabilities. In New Jersey, 1.8 million people, which is about 20% of our state, are on Medicaid, half of whom are kids. And nearly 200,000 of those people are people with disabilities, and 100,000 are seniors. Medicaid also provides in-home care for people with complex needs, which gives family members the ability to have a job and not worry about home health care. Draconian cuts would have a devastating impact on these families. But we're dealing with a federal administration for whom cruelty seems to be the point. And unfortunately, too many in Congress are turning a blind eye to the inhumane impact of the administration's agenda. They've shown that they're more interested in providing tax cuts for the wealthy by targeting and defunding programs that serve vulnerable communities. And that callousness extends far beyond this destructive budget currently being negotiated in Washington, D.C. Look, we'd be remiss if I didn't mention or address what happened right here in New Jersey, in Newark, earlier this month. And of course, the ongoing fallout. On May 9th, Newark Mayor Ras Baraka and Representatives Bonnie Watson Coleman and LaMonica McIver and Rob Menendez were at Delaney Hall, which is a new immigration detention facility here in New Jersey. They were there to tour it as a part of their authorized oversight responsibility. And as we all might have heard, Mayor Baraka was arrested that afternoon and charged with trespassing. And then just yesterday, charges against the mayor were dropped, but charges were brought against Representative McIver. And the arrest of Mayor Baraka and the charges brought against Representative McIver is simply an absurd and shameful escalation of the Trump administration's intimidation campaign against officials who refuse to do their bidding. To be sure, New Jersey has turned into the epicenter for the Trump administration's scheme to deport people and its mass deportation agenda, and also the epicenter to exercise its authoritarianism. Mayors and Congress members are not agents of the federal immigration enforcement, and their job is to protect their constituents, especially from federal policies that erode fundamental rights at the core of our democracy. So Mayor Baraka and Representative McIver are being targeted by the Trump administration for refusing to go along with their ongoing violations of due process. These actions by New Jersey leaders are a powerful reminder that this is a worthy fight and that we should not be cowed by the blatant intimidation tactics. Protecting New Jerseyans from bad actors, whether it's in the immigration context or it's about preserving their access to programs like Medicaid, which improves the quality of life for so many people, is a necessary endeavor. It's now my privilege to introduce Bonnie Watson Coleman. Representative Watson Coleman is serving her sixth term as the Congresswoman for New Jersey's 12th congressional district. She was the first Black woman from New Jersey to serve in Congress, and prior to that, she broke racial and gender barriers by serving for 8 terms in the New Jersey legislature. Her priorities in Congress include advancing civil rights and justice, protecting the rights of immigrants, economic justice, healthcare, and so much more. I'm so grateful to Congresswoman Watson Coleman because I've said before, look, at the ACLU, we don't align fully with any lawmaker. There's nobody out there that we think is going to live our values the way we expect them to. But the Congresswoman has been somebody with whom I've had consistent values alignment for quite some time, and I'm so grateful to have her join us today to share a few words. And we can get right into it, Congresswoman. I wanted to start. There a lot has happened over the last 10 days or so. How are you? And how are you feeling today?
I'm pretty tired, I'll tell you that, but I'm energized. We're still waiting for the complete fallout. I mean, Rob and I have attorneys also, and they're going to be called in to the U.S. Attorney's Office. We have no idea what she wants to say to them or what she wants to extract from us. We are very much concerned about the charges which were brought against LaMonica. I can say that I was there deep in the middle of it and don't see any reason that she should be charged. But I think that this is political intimidation. I think that this is bullying. And I think this is what we see when a democracy is crumbling. And so I know that we have an obligation to stand up for this democracy, to stand up against this administration and its desire to bring all power under its arms and legs, and to consolidate power that rightfully belongs in Congress and rightfully belongs in the judiciary. It's very disturbing that Congress is not, they're not taking our power away. Republican majority is giving it away to
Mm,
the president. So this is the moment that we're in. Thank God, I believe that we're in a movement as well, where the people recognize that the power of the people is greater than the people who are in power, and that they're going to stand up and hold this administration accountable. So, we take it a day at a time. We do everything that we can, and we use whatever tool we have available to us to communicate just how serious this administration is in taking away rights and disappearing people and denying due process and just treating people that it doesn't respect as if we're not worthy.
thank you so much for sharing all that. Let's talk about Medicaid.
Mhm.
Can we dive right in and can we start with a quick recap of where we stand in terms of the process for the bill? And could you demystify that process for us a little bit?
Okay, let me just say two things though that I'm going to make sure we know that we're talking about $880 billion that they're trying to take out of the energy and commerce budget, the majority of which includes Medicaid and child health care. And it's going to negatively impact almost 2 million people in New Jersey. And I've got some information on various districts because I want to alert everyone what they can do with Van Drew and Chris Smith and Tom Kean, who have constituents who are being taken care of right now under Medicaid and who will lose their health care if this budget goes through, if this bill goes through. Secondly, I want to say that we dealt with this and the bill wouldn't come out of the committee on Friday because 5 of the Republicans voted against it. So the chairman told us to go home and we'll come back next week and deal with this again. Instead, the speaker said, come back 10 o'clock Sunday night. And that's what we did. We came back Sunday night. The very little conversation was had between the Democrats and Republicans, because the Republicans held very tight to not being able to change anything in the bill, contending that there was no change in the bill on any of these top lines. And then we proceeded to vote, and the first or second Republican to vote said, I can support it now because of the changes in it. And so we're like, changes? You just said there are no changes. So, ladies and gentlemen, we did this at nighttime. They got the additional votes that they needed to pass the budget on their side. It means to me that they've negotiated something. Now, the something is very concerning because the bills in and of themselves are very bad and negatively impact quality of life, healthcare, schools, food, nutrition, all that kind of stuff, LIHEAP, all of those things that we're concerned about that maintain some quality of life for those most vulnerable. We already knew that those things are in the bill. What the folks who didn't vote for it on that Friday were concerned about was that we weren't accelerating these cuts early enough, soon enough, and these cuts didn't go deep enough. So now we don't know what's in the bill. We'll find out later on tonight. There's going to be a Rules Committee vote on these bills starting at 1 a.m. Another opportunity for Republicans to do this in the dark of the night, thinking that other people aren't going to be paying attention. And they'll try to pass it out of the Rules Committee, because you can't bring it to the floor unless it goes to the Rules Committee. And they have the majority on the Rules Committee because they've got the majority in the House. And that's when we'll see some of the exact numbers that are being included in this bill. And that's when you'll start hearing us talk more finitely about what this bill is going to do to our respective communities. So somewhere between 1 a.m. and 6 a.m., the Rules Committee will take up this bill. All of the committees will present their bills. They'll debate those there in the committee, and then other folks who have amendments will offer their amendments, and I guess anybody else that kind of is available to speak on it will be there. But this is in the middle of the night, everyone. This is very dark. This is long. But you know what? What you do in the dark is eventually going to come out in the light anyway. So we're concerned with a number of things. Medicaid is definitely one of them, because everybody that's on Medicaid that we know is in need of it. It takes care of our loved ones that are in nursing homes. The E&C budget also takes care of our young people and their health care. And so almost 2 million people in New Jersey are going to lose health care. Hundreds of thousands in each one of our districts are probably going to lose health care, including the Republicans, Smith, Bandrew, and oh dear God.
Kean.
Who?
Kean.
Kean. Oh, how could I forget him? Because he is not his father's child. They have hundreds of thousands of constituents on Medicaid. They also have constituents on SNAP. And this budget proposal has a $230 billion cut to SNAP as well. That's supplemental nutritional assistance to families that are in need. So this is an awful bill. It's the worst that we've encountered. We know that it is going to be worse than it was on Friday when it was voted down. It's going to be worse than what they voted out the other night, Sunday night. And it's going to be something that we're going to have to stop as best we can.
And what's the timeline now? So we know what's going to happen in over the next couple of days, but when do you think the final vote will be in the House?
Well, I don't know because it depends on whether or not they have struck enough
Yeah,
censure uh, requirements in this budget that satisfy those that are the most extreme in the Republican side. I know that the speaker has warned us that we don't go home until we pass it. So it could be Thursday, it could be Friday, it could be Saturday, it could be Sunday, it could be Monday, but we'll be here until it's done.
understood. Thank you for sharing all that. Um, what's the next phase of this fight? How do you envision the fight ahead? And what actions are folks in the New Jersey delegation taking to protect Medicaid as it moves through the process?
Well, we've certainly offered a number of amendments that improve the bill significantly, but again, we're not in the majority, so they're going to vote the amendments down again. We've taken to reaching out to advocates. We've taken to reaching out to our constituents. We've held town halls already on what to expect. So we're just going to have to use whatever tool we can to delay, debate as long as we can, offer the amendments, try to reconcile some sanity in this process. But at the end of the day, being in a minority doesn't help. Now, what would help? For us in New Jersey, if this is just a New Jersey call, it would help that Kean's district, Van Drew's district, and Smith's district is inundated with calls from their constituents saying, don't you vote for this bill, do not cut Medicaid, do not cut SNAP. We will not vote for you again, we will not support you. They need to hear that. And so that might mean that you all and your set of network has to educate people in their districts so that they actually know what is happening. Because I'm going to tell you, Republicans are not sharing information. Republicans are not doing town halls. They're not talking to their constituents about what's in this bill. They're trying to pass this bill and try to get beyond it. There's nothing more sneaky or more evil right now than what they're doing are going to do to people most in need on so many different levels, from Medicaid to other kinds of healthcare to access to your prescriptions, to heat, air, everything. The climate, FEMA with all the tornadoes we're having in this country, NOAA, the folks who predict what the weather is going to be, so we could do some planning and some developing and some cleaning up. All of those things don't matter to these people. All they want to do is direct the Ways and Means Committee to find $4 trillion, I think, that they can then use to make permanent and embellish the Trump tax breaks for millionaires and billionaires at the expense of people who need government to be there for them.
Wow. Are there specific things? So you mentioned calling our lawmakers and making sure that they hear from us. Are there other things that New Jerseyans can do right now to support you and make sure that the fight ahead is well resourced and well maintained, so that we can make sure that we are getting what we need from our lawmakers?
Yeah, you can, organize and show up and demonstrate and just worry them to death. Conduct peaceful demonstrations and let people know, not only in New Jersey, but you have alliances all over the country.
Right.
So that awaken those people in the red states that have elected these Republicans to Congress who are not using the authority that they've been given, nor are they upholding the oath to the Constitution. And so I tell people when I go to my town halls, reach out to the people in the red states, help to educate them, because we don't know what, if any, information they're getting. We know that the 3 districts in New Jersey, Republican districts, aren't getting much information because those members aren't doing any town halls. They're not even answering their phones and the questions that are coming in. So information is important. It is important all over the country because we've got people to realize that what they're proposing is going to negatively impact your quality of life. It's going to make us less healthy. It's going to make us poorer. It's not going to save us any money. We're not going to, our prices are not going to go down. They're going to go up. But this is a government of, by, and for the people. And the people have to show their power by speaking out and speaking up.
Congresswoman, I know that there are the folks on the other side of this issue, the folks that want to cut Medicaid, are in the majority, but the margin is pretty narrow, right? And so it's only a handful of votes that we need to support Medicaid to move the needle here and to get a different result. So I saw your fingers. How many do we need?
I think we need 4.
Yeah.
I think we need 4, maybe 3. But let me also tell you this, because there's something else you can do.
Yeah.
I think that this bill, as it will come out of committee, out of rules and onto the floor and out of the House, is not going to be looked upon favorably in the Senate. So we need to start putting pressure on the senators as well. And we know where our 2 senators are going to be. So we need to be talking to people that we know in the other states where they've got senators who are a little bit like, I don't really want to mess with Medicaid, but if I'm being forced to, or they're going to do this to me if I don't do it, those are the folks we need to be getting at. You know, we need to be reinforcing with Susan Collins and McCursky and people like that. Show up for us, because we only need 3 votes over there as well.
That's right. That's right. Thank you so much for sharing all that. I just want to lift up 2 comments that I received in the Q&A. One is an attendee who says that they are on a program that helps them with their sobriety, and they've been sober for over 18 years, and Medicaid pays for their mental health services and for their meds, and they can't afford to pay if their Medicaid is cut. And not only are they scared about that, they're stressed about what it means for their own mental health. And so it's very scary for them. And I just want to raise that anxiety here. And of course, there's another person who's attending who said that their congressman is Chris Smith, and they are reaching out to get him to not vote for this bill. There are so many seniors in nursing homes in their district, and they're on Medicaid, and they've been told that Chris Smith is not holding any town halls. And so, you know, there's this effort, it seems, to dodge the conversation from constituents as well. And we need to hold the folks accountable for that.
So in New Jersey, that's why we need to be more organized in Chris's district, in Tom's, and in Bandrew's. I've done town halls in Kean's district and in Bandrew's, and I'm going to Chris Smith's district. And if I have to go again, I'll go again. Because if they're not going to talk to their constituents, somebody needs to, and I'm willing to do it. But that's where we need more organizing, more people to show up, more people to protest, to be outside of their offices, to demand, to just inundate them with calls. They can't just respond to 1 or 2 or 10 or 15 or even 20. They've got to respond to hundreds and hundreds of people who are demanding that they protect their health care, their mental health care, their access to whatever they need to stay sober. And all credit to the person that said he or she is worried about their sobriety. We're worried about those things too. We've got members that are really making that an issue. And so we know that between taking away research dollars for cancer for children, taking away mental health dollars from SAMHSA, from NIH, the things that they're taking away, as well as how they're making us less safe in the food that we eat because they're reducing even the FDA inspections. This is a moment for people to rise up and to have their voices heard.
Thank you so much, Congresswoman. We have about a minute left with you. Is there anything more you'd like to add? What gives you hope right now? What's driving you? What's motivating you? What's inspiring you?
Well, for me, the same God that was on the throne when Joe Biden was president is on the throne now. And at the end of the day, something's going to happen here. I am definitely guided by my faith. I'm also encouraged when I see the kind of protests, demonstrations that are showing up all over the country around issues, around budgets, around workers being fired, offices being closed, and things of that nature. That's very gratifying for me because when he first got elected and he bombarded us with all of those EOs, executive orders, we were all stunned and we were in a moment. But I believe that we're now in a movement. And the movement is in the direction that people understand, as Dr. Martin Luther King once said, that we're feeling this fierce urgency of now because we are. And I thank you for giving me the opportunity to speak with the folks that are on here. And I hope that everyone on here is committed to talking to 10 or so people in other places, to get them to talk to 10 or so people in other places, and on and on, because we need to educate people on what's going to happen to them. And they are not getting that information.
We will certainly commit to that, and we will share this message far and wide across the ACLU network. We've got 30,000 members across New Jersey, and nearly 2 million across the country. I'll say this, Congresswoman, I saw you at the Hands Off rally in Princeton where we both spoke. I saw you outside Delaney Hall in earlier this month. And I'm sure I'll see you in the streets as well as at town hall moments and speaking truth to power every single chance that you get. So thank you for
We really
leading
do
up.
meet at the right places, don't we?
We do. We really
Your
do.
work.
Thank you so much, Congresswoman. It's a
Good
joy to
night.
have you, and really appreciate your leadership.
Thank you. Bye-bye.
Before we turn to our panel, I just wanted to lift up a couple of comments that I've received here. I think it's important to lift up the stories that we're hearing. One attendee says that they recently lost their job and Medicaid is how they're affording their insulin and their medical supplies because they can't afford COBRA. Another says that they're on a program that pays for them to have an aide come in and help them with daily tasks that they're not able to accomplish as a person living with blindness. And so they wouldn't be able to live at home independently otherwise. And so I just wanted to lift up those stories because I think it draws attention to the human impact of this issue. Speaking of the human impact and the policy impact, I want to bring up now a few different folks. First is Theresa Luoni, who is a mom living in Basking Ridge, who relies on Medicaid for her family, including her two sons who have disabilities. Next is Maura Collinsgru, who is a health policy advocate with New Jersey Citizen Action. We also have Brittany Holom-Trundy, who is a senior policy analyst with New Jersey Policy Perspective. And finally, we have, last but not least, Antoinette Miles, who's the executive director of the New Jersey Working Families Alliance. Theresa, Brittany, Maura, and Antoinette, thank you so much for joining us. And let's kick it off with Theresa. Theresa, I've heard and read your story on numerous occasions. Could you share a little bit about how Medicaid impacts your life and how these cuts might impact your life? Oh, you're muted still.
Hi, I'm on now. Um, Thanks for the opportunity to be here today. As you said, my name is Theresa Luoni. I actually live in Tom Kean's district, and I'm the full-time caregiver and mom to my 12-year-old twin boys, Dylan and Max. Both of my sons are profoundly autistic. Dylan is nonverbal and Max is pre-verbal. They require constant care and support in every aspect of their daily life, from eating and dressing to communicating, learning, and staying safe. Our journey actually began with a crisis. Dylan and Max were born at just 26 weeks gestation, extremely premature. At the time, I was working full-time and had private insurance through my job. I thought that would be enough. But the truth is, when your children are fighting for their lives in the NICU, no private insurance plan can fully cover what they need. It was Medicaid that stepped in and paid for the life-saving care they received. The machines, the specialists, the round-the-clock support. Medicaid helped save my son's lives. And when they got older, Medicaid didn't stop helping. As they were diagnosed with profound autism and their needs became clearer, Medicaid became the foundation of their support system. It now covers essential therapies they rely on: speech, occupational, and behavioral therapy. It pays for the equipment that helps them stay safe, and it funds the in-home support that gives me the ability to care for them full time. Without Medicaid, they wouldn't just be missing out on support, they would be missing out on survival. Families who rely on Medicaid are already doing everything we can to just keep going. I had to leave the workforce to become my son's full-time caregiver. That means we live on a very limited budget. And that's the case for so many families like mine. We are already stretched thin, emotionally, physically, and financially. So when we hear about cuts to Medicaid, we know what that really means, because we know that any amount of cuts to the Medicaid program would mean that families like mine are going without basic care. It means children like Max and Dylan losing access to therapies they need to grow. It means parents choosing between rent and medical supplies. These aren't numbers in a budget. These are real lives, like the participant who's using Medicaid to get insulin, or the in-home supports so that the blind participant can live independently. And what's even harder to accept is that these cuts are not being proposed because we've run out of resources or there's been any evidence of significant fraud and waste in the program. They're being proposed to make room for tax breaks for the wealthy individuals and big corporations in this country. So let's be honest about what's happening. The most vulnerable people in our country, children with disabilities, medically fragile individuals, families living paycheck to paycheck, and seniors, are being asked to give up the most basic care so that the wealthiest can get just a little bit wealthier. That's not just unfair, it's immoral. Medicaid isn't a handout, it's a promise that in this country, we take care of our most vulnerable, that we don't leave children like mine behind, and that we don't balance budgets on the backs of families who are already fighting to survive. We're not asking for anything extra. I'm asking for what my children need to live, to learn, and to have a future, and to be able to live at home with me as children. Medicaid's not a luxury, it's a life for us.
Thank you so much, Theresa, for sharing your family's story and the ways in which it's going to impact you if this program is cut so drastically. I want to keep you here and invite also my fellow colleagues on this panel to have a conversation together about what this means for New Jersey and New Jerseyans. So I'll start with this question. We've now heard from Theresa, and we've heard from Congresswoman Watson Coleman, and we've heard a few stories that were in the chat. I wanted to ask, who else are the faces of Medicaid in New Jersey, and what will cuts mean for them? So I open that up to anybody that wants to share. Are there other folks that we haven't yet talked about that will be impacted?
Yeah, hi, Amol. This is Maura. Really powerful to hear the stories of people like Theresa, who represent millions of people around the country. So thank you, Theresa. You remind us what we fight for, and we all need to fight. But the faces of Medicaid in New Jersey and across the country, particularly the ones that are being targeted, are working adults. They're the people who have the lowest incomes, who work jobs that don't provide for their health insurance. Think of people like retail workers, warehouse workers, food service, people who have a part of the gig economy. That they are individuals that we opened up Medicaid to under the Affordable Care Act. And that is the population that they are very focused on, and the cuts will be made to. And the other population, that is in keeping with the cruelty and the retribution that this administration exacts on so many people, are immigrants. States like New Jersey will see their Medicaid funds cut because we cover all our children. And that will result in a 10% rollback in the amount of federal money we get for our Medicaid expanded program.
Yeah, thank you so much, Maura. Brittany, Antoinette, any other thoughts?
Yeah, I think Maura hit the nail on the head, really. Just talking about the working people and working families that are going to be impacted by this. And particularly our young people, our folks who fall into that gap of where they're no longer on their parents' health insurance under the provisions of the Affordable Care Act. And they're now either living with their family or living on their own, but not earning enough to qualify for the Affordable Care Act programs, right? So they are on Medicaid and they are not earning enough for them to be able to sustain their own health care. And so I think that while we are keeping in mind very much so our seniors and those who are disabled, there are also many young people who are falling into that coverage gap that are going to need life-sustaining health care. And particularly, I appreciated how Theresa spoke about, her personal story, while she was pregnant. And we know that in New Jersey, we made so many strides to address a lot of the maternal health crisis that we face, particularly among Black women. And we know that Medicaid has gone very far in making sure that we cover the births and give coverage to Black women who nationwide in this country, Medicaid finances about 40% of all births nationwide, but 64% of births by Black moms are covered by Medicaid. And so I think that we also are going to be facing continued disparities in care as a result of these cuts. And it's something that, we're going to be looking at potentially even in the 1950s here, moving into 2025, still having the same devastating, disparate outcomes when it comes to maternal health. So those are the two things that I wanted to lift up.
And I'll just very quickly, it just kind of tacks on to what others have already said. and I do apologize for my voice. Toddler brought home a cold. Speaking of health, you know, we have about a little less than 1.9 million enrollees on NJ Family Care right now, and the Department of Human Services is estimating that 1 in 5 are going to lose coverage. So that's around 376,000 people, and they're saying half of these, you know, working adults are part of the Medicaid expansion that Maura mentioned. And that's so half of those folks is 200,000. So there's almost 176,000 people, you know, that aren't even part of that group who are going to be affected. And something that's, you know, I think some people think, oh, they're changing eligibility or something like that. No, a lot of this is people getting pushed out by increased red tape, just like increased frequency of income verification, things like that. You know, people get mad about having to find an appointment at the MVC for their real ID. Imagine having to get through documentation and work with limited office hours and things like that just to have your health coverage, and have it every few months rather than have it every few years. And then if you lose coverage, that means you're not getting doctor's appointments. That means you're missing a diabetes diagnosis. That means more emergency care because you're missing those things. You know, it has this domino effect, and people think, oh, it's not, I don't have Medicaid, so it's not going to affect me. Well, you know, my toddler brought home this cold. Like, what about your child's classmates? What about your neighbors? Like, this is going to affect everybody, regardless of whether you have Medicaid coverage yourself or not.
I want to lift up something that Maura said and others echoed. You know, there are many different categories of people, a huge cross section of our state and our country that's going to be impacted by this. But Maura, you highlighted the impact on immigrants. And so this is potentially sort of another weaponization or another weapon in the Trump administration's fight against immigrant communities. And we're seeing them dehumanize immigrants across so many different fronts. And yet again, we're seeing it happening right now. And it's just impacting so many of us in so many different ways. My next question is about the healthcare system more broadly. This is going to affect not just individuals who receive Medicaid, but also providers of healthcare around the state, including doctors and nurses and hospitals and clinic. What does that impact look like? Does that have a major impact for the industry in the state?
Yes. A big yes in many different ways. Since the Affordable Care Act expanded coverage to millions of people around the country, states around the country, including New Jersey, have cut back on our charity care funding because so many more people were insured. And much of what is in this bill will reverse those gains. People will have less coverage. They will pay more for their care. And the impacts will be felt most acutely in clinics, in hospitals. There will be job losses for healthcare workers. And there are, again, those really specific cuts around things like Planned Parenthood. They are banning Medicaid funding to Planned Parenthood for reproductive health and family planning. I mean, think about this. This is 2025. You know, we are talking about a provider that provides, you know, a great deal of care for reproductive health to people all across the state, preventative, well care, all kinds of things, cancer screenings. So it's really a damaging bill. And even though the cuts may be targeting specific populations, immigrants and low-wage workers and others, any cut to Medicaid will have a ripple effect across the program. It is not siloed. So people who have disabilities may see their home health care cut. People who are in nursing homes will see a rollback in the rolling back the number of nurses that will be required to care for our seniors. So there are all kinds of ramifications here, and we will all feel the pain of it.
Yeah, can I just add that yeah, what Maura was saying, it has this again domino effect where our Medicaid rates in New Jersey are already very low, and it's hard to make sure that we have providers in the network and have sufficient and quality care for everybody. And so if you have cuts and you have more uninsured patients, you have fewer people with coverage, then suddenly we're going to see fewer providers, that are, one, willing to provide that care, but two, just we're going to see hospitals and clinics closing. This is what happens in rural areas all the time throughout the country. But in New Jersey, we're a somewhat smallish. I'm from Montana originally, so like to me, everything is really close by in New Jersey. But it still is going to have that effect if you have more and more people who are uninsured. Hospitals and healthcare facilities can't stay open if they don't have patients, or don't have patients who have coverage, who are struggling to pay for services at all. So just as an example, I pulled some numbers, and like for Salem County, for example, in South Jersey, nearly a quarter of the population has some form of Medicaid NJ family care coverage. And in Mercer, a fifth of the population does. In Essex, around a quarter of the population does. So like that is huge. If you see cuts, you're going to see just consolidation, like this reduction in healthcare that's even available. Because, as providers close, as things leave, you then can't get appointments. Then the doctors have less time for the patients that they have. It has a big, terrible effect on everybody.
Mm.
And I think for disabled people in this state, any reduction of services will mean that we have less people who are able to be productive members of society. Like the services that disabled people get through Medicaid are services that allow them to be out in the community, to have jobs, to live independently, and be able to partially support themselves. So whether the programs are teaching them how to do that, or providing this places to do that, or a job coach, or the in-home aid that will help the blind person, because all these things are so important for people to have a quality of life.
Yeah, I'll just very quickly add that right on to what Brittany and Theresa were saying is that, that when we see hospital closures, it has a ripple effect throughout communities. And we know that, when we think about our healthcare system broadly, that even in New Jersey, we've experienced hospitals under financial strain, often having to either consolidate or merge into other larger hospitals or face closure altogether, like St. Francis Medical Center in Trenton, or recently CarePoint hospitals in Hudson County going through a lot of financial strain and are fortunately are now being able to stay open. But we know that there's going to be a rippling effect that also harms our healthcare workforce, quite frankly. And we know that there will be job loss even amongst unionized hospitals. And we know that there will be critical impacts that have rippling effects out in the community. So it's about the patients, it's about the providers, but it's also about the workers who are providing that care and the impacts that happen there as well.
And there's also a generational impact. It's not just about the individual and their family and their immediate community, but also the longevity and the impact on their children and their children's children, and the ways in which that family will be able to thrive or not. It's a sad reality that one's economic mobility is tethered to that of their parents, right? Like if in short, if you were born poor, most likely you're going to stay poor. And if you're born wealthy, more likely than not, you will have more chance to become wealthier. And so the fact that we are taking a lifeline away potentially from hundreds of thousands of the most vulnerable people in New Jersey, it's going to have a long-term impact for their ability to thrive individually and their children's ability to thrive and their generations of their family being able to thrive. Speaking of economic impact, Theresa, you look like you have something to say.
Oh, no.
Make sure. Okay, yeah, I saw you on mute. Sorry. Speaking of economic impact, my last question for you all is, how does this impact the state's finances in New Jersey? Like many other states, if federal funding is cut, tough choices will need to be made at the state level. So what can we expect from New Jersey's budget?
I'll jump in here because that's NJPP's big thing is the state budget. So, the Department of Human Services is estimating that the Medicaid, like the healthcare losses due to these Medicaid cuts would be about 3.6 billion a year likely, which is huge. Again, I keep saying that word, but it is. Our state budget, like the proposal for this next year is 58 billion. So it seems like, 3.6 billion, like that's a fraction. That's a humongous amount. And then you add on the other things that are being cut, like SNAP. I think they're estimating there's potentially another 100 million. There's all of these holes that are going to have to be filled, and there's a knock-on effect. There's going to have to be some terrible decisions that they might have to face. Like a lot of this, as Maura mentioned earlier, is framed in a way as punishment. So one of the reductions for Medicaid is in matching rates is based on cover all kids. Like if you're providing more generous care, we're going to cut back your funds. And so, and that's a lot of what's going on here is punishment for having had a more generous or a healthcare system that you had developed more. So there's a lot that's there, and then I think we're talking mainly about Medicaid here, but there's knock-on effects with the ACA stuff as well, the marketplace. If they're not extending the stipends, the premium tax credits there, then suddenly state dollars ones that they're using to make healthcare more affordable for people and for more people in the state suddenly have to go to filling those gaps, and everything just has to move in a way that suddenly people are going to be cut off, and they're going to be, I worry that our state leaders are going to, they're going to have to face like, can we keep doing the advances that we've been doing? And I don't want to see those reversed myself. That's awful. Like that, we're going back decades, as I think Antoinette mentioned earlier. We're living this. There are continuations, and we'd be reversing back to how things were years and years ago. So it's just it's huge. Sorry, go ahead. I'm sure someone else had.
Yeah, I'll go quickly because I certainly want to hear from Theresa. But all of us here between Working Families Alliance and Citizen Action are working on the budget through the For the Many coalition with New Jersey Policy Perspective, and we already knew going into this budget cycle that New Jersey had a $1 billion deficit going into this year, and so we're already certainly operating from a place of needing more revenue so that we can make sure that the programs that we already have can even be maintained. And it's, we are at a critical point and frankly, a crisis point. We have to pass a state budget by July 1. That's, written, into the law that we have to pass it. That's what Trenton has to do. And we know that the state budget is not going to simply be able to absorb the shifting burden that's going to happen if these Medicaid cuts come through in the way that Republicans are currently pushing for. I mean, any cuts to Medicaid, big or small, but is going to strain our state budget and likely lead to service cuts. And we already, have lots of partners who have many programs that are already not being funded, whether it be, or either they're not being funded or they're being held at the same level that they were funded as in the previous budget. And so I think that the state is going to have to really become creative when it comes to looking for savings, but also just frankly pushing more and making sure that we get the revenue that we need so that even if we are facing tough choices, that we are still able to do what is necessary to try to maintain a lot of the programs that we have. I want to also just mention from even a federal budget perspective, I know we've talked a lot with the Congresswoman about her work and also, quite frankly, the Republican representatives that have not met this moment and are continuing to push forward a budget that causes harm. But we have Congressman Frank Pallone of New Jersey, who stepped up and has been pushing really hard in his committee, which is the key committee that's looking over this Medicaid cuts in the bill that's being put forward. And we know that they are pushing forward and making sure that we understand just how millions of Americans losing coverage is going to impact at the state level. And so we have a few weeks to go here in New Jersey for our state budget. And so now is the time actually for people to be reaching out to their state lawmakers and making sure that we're communicating to them that if these cuts do come down, what we need to do at the state level to help us maintain.
And just to add, not only would cuts to Medicaid affect the healthcare system, but in New Jersey, it would also affect our public schools because Medicaid and the SNAP program both use federal funds to support some of the districts in New Jersey. So again, it would mean the most vulnerable school districts would receive less funding, which means that services that make it so that disabled children can access an education or a free lunch program or a reduced lunch program. A lot of these things just won't be possible. And who wants to, again, step back? Why would we reduce our children's futures and the education system by doing these cuts?
Thank you all so much. I want to lift up a couple other stories that I'm seeing in the Q&A. One is a resident of Salem County who said that they know firsthand the struggles of hospitals staying open. Salem has a high poverty rate, and many who live in Salem County are on fixed incomes, including seniors and people with disabilities. And there are a lot of single parents in Salem County as well, just struggling to make ends meet to survive. Another person says that they depend on Medicaid, and they've been using it for their entire lives, and they depend on it for their very bad asthma. Another person says that they work at a psychiatric hospital, and 2/3 of the patients that come there are on Medicaid. Any cuts would prevent most of them from seeking care. People don't realize how much and how many people are affected by Medicaid. So as I said, I think it's important to remind ourselves of the humanity, the folks that are advocating for cuts are talking about this in terms of dollars, and I think we all need to talk about it in terms of lives as well. So it's crucial.
Can I just say, I think our latest number for the Cover All Kids program, for example, was 46,000 kids.
Wow.
Who weren't previously eligible for coverage that we're covering with state dollars. And that's the type of thing that they're threatening, because they're saying, hey, we're going to take federal dollars away because you're using state dollars for that. So that's ripping healthcare away from tens of thousands of kids. It's terrible.
Yeah, absolutely. So let's talk about what we can do. We have just a minute left. You know, I think it's time for a call to action. We talked about calling our representatives at the federal level. We also talked about calling our representatives at the state level. But Maura, Antoinette, Theresa, Brittany, it'd be great to hear from you about other things that our folks can do, and then I'll describe what's on your screen.
Yeah, thanks, Amol. I wanted to let people know there are protests happening every Tuesday at noon in Chris Smith's district in Toms River, Wednesdays from 4 to 5:30, and again Tuesdays at 4:30 in Van Drew's district. There's also things going on in Tom Kane's district. I think Antoinette probably has the most up-to-date things, but we would invite people to follow the organizations that are on this call. This is a collective effort from across the state, indivisible groups and others who are pulling these things together in unison, because we're going to need to continue to fight, because this will not end with the House. We will have a battle with the Senate, and we have some good voices here in New Jersey to help us to save this program.
Yeah, I'll just uplift that our national partners at Working Families Power have been hosting virtual phone banks. I know we're going to give folks a phone number to connect right to their representatives, but for the last 3 days and also tomorrow, there's phone banks going on nationally to reach out to representatives and to say hands off our health care. And so that's happening from 2 to 4 tomorrow. Folks can sign up through New Jersey Working Families Alliance page on our Mobilize. Happy to share that information out with folks. And as far as like in-person actions, we actually just this past week, we had a small canvas in Rahway that actually went to voters to talk to them about the budget and what is going on. And so we're hoping to do more of those moving forward, especially as this process unrolls, and get people out to the doors to talk to their neighbors and talk to families about what the impacts are. We don't have any scheduled just as yet, but certainly we'll keep folks informed about those moving forward.
I'll just say, I don't know if Theresa has something, but I'll just say really quickly that the state budget is a big part of this process as well. It's hard to follow everything. You can follow New Jersey Policy Perspectives work on the budget and ask us questions on the state budget. But you know what we're going to be seeing, that they're supposed to finalize the state budget by the end of June. We'll see how they're reacting depending on what the federal government does. But for folks who are interested in being involved at that state level, you know, there's going to be a lot of things happening in the next several weeks as they try to figure out the state budget in response. So reaching out to your state lawmakers will be a big part of it as well.
Great. Theresa, any thoughts on what folks can do?
That they all said. Calls matter, showing up matters. I know a lot of people think it's little things, but one phone call a day means that all these voices can't be ignored. And it's so important, because collectively we are stronger than we are individually.
Thank you so much for that. Couldn't have said it better myself. So lastly, Mike, we can put up the screen now. There's a call to action button or number that I wanted to share with you all. Here it is. So this is a line to connect with your representative. So if you dial 866-473-5915, it will connect you to your member of Congress's office. And then we also have the numbers for the Congress members who have said that they that have not yet committed to defending Medicaid. And so we need to put the pressure on and make sure that they hear from us. So you can find your Congress member through the connector line, or if you know who they are, you can dial them directly through the numbers listed on your screen. So I want to thank everybody for joining us, everybody who joined as a participant, and also to Congresswoman Bonnie Watson Coleman, to Brittany from NJPP, Maura from Citizen Action, Antoinette from New Jersey Working Families Alliance, and Theresa from Basking Ridge. Thank you so much for spending a little bit of your evening with us. And let me just uplift something that Bonnie Watson Coleman said and that Theresa echoed, which is that the power of the people is greater than those in power. So when we make our voices heard, I believe that we are unstoppable. So thank you all so much for joining us. Thank you to my colleagues at ACLU across the country for helping put this together, and thank you to each of you again.